I'm Eric Parker this morning on CT21, the vaccine or weekly testing. It's a mandate for state workers with the deadline to comply now in the past. Who's on board and who's resisting and why? We're getting insight from the state's chief operating officer and from a union leader and a UConn nurse. Connecticut now has its first inspector general. Attorney Robert Devlin talks about his role investigating police officers. And in our Sunday Spotlight, police and people on the spectrum learning from each other. And we're learning from them about efforts to help everyone understand each other during traffic stops. It's all this Sunday, October 10th. CT21 starts right now.
From Channel 3, this is Connecticut's most watched current affairs program, CT21, with Eric Parker, sponsored by Hartford Healthcare.
Good morning, I'm Eric Parker. Last Monday was the deadline for state workers to either show proof of vaccination or to agree to weekly COVID testing in order to continue their employment. As of Tuesday, about 1,200 workers, or 4% of all state employees, had yet to comply. Efforts have been underway to track down each employee in that group. Here with an update on what the numbers look like now and what happens next is Josh Jabal. He's the Chief Operating Officer for the state of Connecticut. Josh, thanks for being with us. It turned out this was sort of a soft deadline. So tell us what happened during the course of the past week.
Sure. Well, as we got closer to the deadline, it was clear that some people were still struggling to get their information in and upload it. And, some people had waited to the last minute to get vaccinated or get tested. And the last thing we wanted to do was, discipline anyone who was making a good faith effort to comply with the mandate. So we've taken a little more time. Our teams have been working individually with all those people who are still on the non-compliant list to make sure that if they were trying to get compliant, they had every opportunity to do so.
Now, tell me about this policy as a decision for the Lamont administration. Why go this route? How was this decision reached? And what's the impetus behind it?
Sure. Well, if you look back over the last several months during the Delta wave, right, Connecticut has had the number one highest vaccination rate in the nation of people fully vaccinated among our eligible population. And we've had the lowest number of average daily cases of all 50 states. Those two things are very related. Our high vaccination rates are keeping the state safe. They're keeping our workplaces safe. And so as we look forward to the winter and the uncertainties of what curveballs COVID is going to throw us next, the governor's view was the most important thing we need to do to keep our state safe, keep our employees and the people we serve in our offices safe is to make sure people are getting vaccinated. But even if they have a reason they really don't want to get vaccinated, at least get tested so that we can be sure that we're keeping everyone safe.
Do you have a feel for, and we're going to talk to some folks sort of on the state employee side of things coming up in just a moment, but as an administration, do you have a feel for those who are still in the non-compliant group? What is the rationale behind that? Are you hearing a common theme among those people who are still holdouts?
Fortunately, there's very few at this point. I think by the time we're, really settled down here, it's going to be maybe 1%, 2% of the state workforce. So we're very grateful that the vast majority of our employees are vaccinated. I think we're about 80% of our state workforce is fully vaccinated, about similar rates as the rest of the state. And most of the remaining people are agreeing to be tested weekly. So I think, there's a few people that are just defiant and for whatever personal reason, they don't intend to comply. And, unfortunately, we're going to need to part ways with those people.
You and I have talked about vaccines a number of times over the last, 6 or 8 months. Obviously, this is something that the administration believes in, that the federal government believes in. Do these types of programs, whether it's state workers or other workers at private businesses in Connecticut, do you think that plays an important part in maybe getting some reluctant people to get those shots or, I guess, to agree to the testing?
Yeah, we've seen in the data and the survey data, a lot of people have just wanted to wait a little bit longer, see more and more people get vaccinated before they're really confident. And, that helps, I think leading by example. This is one of the other issues that the governor motivated the governor to issue these executive orders. We're one of the largest employers in the state. And leading by example with a mandate like this is important to help show other large employers, many of whom have already implemented their own vaccine mandates, that it's a good thing to do. And that's how we really will make sure we're protecting the state going forward.
Just about 30 seconds left, Josh. I want to ask you this. As we saw the numbers drop, it started out, and maybe it was a paperwork error, but started out with a big number. It shrunk, as you said, maybe down to 1-2%. Is that gratifying? Are you glad to see that we got to that kind of place?
Yeah, absolutely. I think it confirms what we suspected, which is the vast majority of our employees are vaccinated. They care about the health of themselves, their families, their coworkers. So we're very grateful that we've achieved the very high compliance rates that we did.
All right, Josh Jabal, the Chief Operating Officer for the state of Connecticut, giving us some insight into the vaccine mandate for state employees. We appreciate you being with us on this Sunday morning, Josh.
Great to be with you. Thanks, Eric.
And we want to continue our conversation now with insight from a union representing state workers. Rob Barrel is the president of SEIU 1199 Northeast. Also joining us is Jill Elsgaard. She is an ICU nurse with UConn Health and a member of University Professionals AFT Local 3837. Thanks to both of you for being with us. Rob, I want to start with you. What have you heard from members about this requirement?
Well, look, I understand that the overwhelming majority of our membership has actually been vaccinated. But the big concerns that folks have are around the staffing crisis, which actually way predates the pandemic. What we're seeing right now is that, Connecticut is reaping the rotten fruit of a bad seed that was planted, way back in 2008 during the Great Recession. We have 15 years of disinvestment in human services. We represent in our union 6,000 public sector healthcare workers, and there are currently 2,000 openings that exist. We're reading stories in the Hartford Courant about kids at the Children's Medical Center in Hartford who are, stacked up in the emergency room because there are no inpatient units. Meanwhile, there are inpatient units, public sector inpatient units like that at Solnit South that have been closed due to short staffing. So there's a great deal of anxiety amongst the workforce, which is, beyond their breaking point after, in many cases, being mandated for double shifts, even triple shifts. They're concerned both about themselves, but also, of course, about their patients.
So it sounds like the union would like to see, more state employees hired, try to fix some of that shortfall in numbers. But generally, the vaccine program, does the union have an objection to it?
No, absolutely not. We support the medical science. We believe that folks, should be vaccinated. What we do not want to see is that in places where there are already incredible shortages of staff, meaning that there are real patient needs that are not getting met, that folks are forced out of work. And just to give you an idea about what we're talking about in terms of lack of availability of staffing, there's currently a waiting list that is into the hundreds, or over 200 people for folks looking for addiction treatment. We are all well aware of the crises that are taking place in terms of behavioral health, with folks dealing with anxiety, depression, suicide rates are up. Folks are looking for treatment to cure themselves of addictions, and there just are not the staff right now to meet those needs. In years past, Connecticut could claim credibly that there was a fiscal crisis, and that so the staffing positions were not being filled because of the fiscal crisis. There is no argument around that now. There's $3 billion in the rainy day fund. There are surpluses that are projected. So we're asking that the state recognize the human need and the human suffering and hire people to fill those positions and treat those patients.
Jill, you're an ICU nurse. What's your take on the vaccine mandate, and what are you hearing from your coworkers?
To echo what Rob mentioned, the concern is, it's going to further perpetuate an underlying problem that has been there for years, which is the short staffing. How are we going to take care of patients safely with nurses, to fill these holes? We're already filling them. We're already short-staffed. And again, how are we going to come up with these nurses? How is this safe for patients when you have nurses mandated working 16 hours? So that's the real concern here is, what are we going to do to make things safe for staff, for patients, and for everyone?
Are you hearing objections from your coworkers, from other nurses there at UConn that they don't want to get vaccinated?
What I'm hearing again is just, the short staffing, the concern, we're already maxed out. The pandemic really, really pushed nurses and healthcare in general. It's happening everywhere in the world. But for UConn specifically, this has been an issue, as Rob mentioned, for years. I've been there for about 10, and it's been there this entire time. So this is going to further perpetuate that problem. All
right, Jill, thank you. Jill Elsgaard, an ICU nurse at UConn Health and a union member. Rob Barrel, president of SEIU. We appreciate you both being with us, giving the state employee workers their voice on this Sunday morning. Thanks very much. Coming up later in our program, how one local police department is educating officers on the best ways to handle traffic stops when the drivers are on the autism spectrum. And next, Connecticut's first inspector general. Attorney Robert Devlin talks about his new assignment. He was sworn in late last week. We'll tell you about that coming up.